We are live. Woo, woo. I was having some technology problems today, you guys. It is must be a full moon or something because I also spilled my coffee on myself. So it's one of those days. But we are so lucky to have Mackenzie Abramson on the show today. She is coming at us from Maryland, right? Or where are you
Yep,
coming at?
Maryland.
Yep. Okay, Maryland. I was like, oh, is it one of the other ones? So, Mackenzie, tell us a little bit about yourself and your role at Global Genes. And today we're going to talk with her about how does she create content that is for patients, but also researchers, but also clinicians. A lot of us have these like multifaceted audiences, which is great, but it does mean you have to be really careful about ensuring your patient content isn't too heavily scientific focused and your scientific focused content isn't too much in layman's terms. Otherwise, you're not going to attract the right audience. So she's going to tell us all about that. First, tell us about your role and what you do and your background. And I will now spill the coffee while we're doing that.
Yeah, absolutely. So my background is actually in public health. I have my master's, and so I really started working on content for other people in undergrad and grad school, where we were working on programming for different public health projects. And then I am currently the senior manager of research program communications at Global Genes, which means I get to work with our team on the Rare X research program and really work on the marketing, recruiting content with our community engagement team, ensuring that patients and our patient advocacy groups are getting all of the materials that they need that will suit their community. But then I also get to work on developing content for our researchers that we want to get into rare disease research and clinicians that help these patients. And it's a really unique opportunity because I myself am a rare disease patient and I'm in the chronic illness space as well and women's health. So I'm so uniquely positioned to kind of bridge this gap between all of these different audiences and communities because I am a patient myself.
Yeah, exactly. So, why is it important for someone like you that understands the advocacy, the healthcare landscape, to be a writer for these types of audiences? Why is that unique niche that you feel so important for someone like you to be in that role?
Yeah, I think it's really important for people who have, I think I might be jumping ahead a little bit, but that have these lived experiences to
Yes.
kind of connect with the people who are supposed to be providing care or doing research. There's so many times where I've heard researchers say or clinicians say, here's what's important when you have, XYZ. But then the patient comes in and says, well, here's what's wrong in my world right now. This is actually what's important to me. And so being able to communicate those things effectively with each other, and find that bridge between, okay, here's what research says, but here's what's really important to the patients, is what really gives patients the opportunity to have a voice and help researchers guide to new therapies, new treatments, and all of these different aspects that are really important.
Yeah, and it's so true. This is something that we do at Lauren Perna Comms, not to the same extent by any stretch, but we are always trying to kind of transform that technical talk. And that's why I wanted this theme. But I was actually just chatting with a client yesterday, and we were saying that there's so many different ways to talk about the illness that we focus on. That a lot of the researchers use the protein name, which the patient is going to have absolutely no idea what that means. So it is finding that balance between the researchers and the clinicians using this protein and these people having everyday lived experience of a disease. So it is true. So what's your process for creating these types of materials? How do you balance that? You don't have to give away all your trade secrets, but walk us through that kind of process.
Yeah, so I think it's different for depending on which audience we're talking about. So if we're talking about kind of patients and patient advocacy groups, I work so closely with our community engagement team who has that everyday contact. And our goal is to meet patients where they're at, right? So
Yep.
we want to ensure that these experts in the patient advocacy groups who know their communities best are having their voices heard, and they tell us what they need. And that's where we start. So, um, for a community that is, let's say, a neurodegenerative community, you want to make sure your language is at a reading level that will be understood by all. You want to make sure that people who are new to this, that are caregivers, are going to understand your content just by that first look without maybe knowing so much about the condition or the disease. So really meeting patients where they're at when that's your audience is so important. Knowing maybe some communities don't like to read and they want visuals, and
Yeah.
things of that nature are really easy to accommodate. Of course, you also want to accessibility is important. So ensuring you have colors that are able to be seen by people with visual impairments, having someone who can read it out loud. Sometimes audio recordings are better.
Yeah,
You
that's
always want, if it's visual, you want to make sure you're using captions. It's just really depends on what kind of community we're serving in terms of patients. So again, just meeting them where they're at. For researchers and clinicians, it's quite a bit different. They want all
yeah.
the technical
Mm-hmm.
language, right? And then they also want the stuff that we give patients because they want to be able to relay that to patients. But it's very much a kind of twofold. You do the patient content first, and then you kind of do the technical content
Okay,
as well.
interesting. Yeah. And
And I like it that way because it's easier for me to then explain to researchers or clinicians, like, here's what the patients are saying. And this is why it's important to do it that way.
And do you get a lot of feedback from either audience? Like I from the patient, do they come back to you and they still don't understand, or do they give you feedback when, thanks
Yeah.
for writing it this way? I
Yeah,
really
absolutely.
got it. Yeah.
So we definitely get feedback. We've had multiple rounds of feedback with different groups that said, this version is too much. Now this version is not enough. Like, how do we find that happy medium? I really enjoy working collaboratively with patients and patient group leaders. It's so easy to do a Google or Word doc and have suggest changes
Yeah.
so that they can tell me this word means nothing to my community, or this word has to be in here because that's what will
Oh, that's
you want
cool.
your
Yeah.
keywords and SEO, all the things. So you want
Yeah.
to make
Yeah.
sure you're getting what they need. And similar with researchers and clinicians, they are so smart and they know all the things. So whenever I'm creating that content, it's great to have them tell me, like, they're the experts in a condition or the research. Here's some things that we think they should know. And then it becomes my job to translate that to the patients, which is really fun.
Yeah. So, how do you learn about all of these diseases? Do you have a scientific background? Did you secretly go to med school and I'm just not aware?
No, no, no. I wish. I think,
Yeah.
future Mackenzie is thinking about going back to school at some point, but I think that having a background in public health gave me that kind of basis
Mm,
for a research background. I did my graduate capstone on albinism in Rwanda, and that meant that I spent 6 weeks
absolutely.
there studying and researching and interviewing patients and interviewing researchers out there, and then
So
writing,
awesome.
doing a paper that I was for my capstone, essentially, to express kind of what is happening in Rwanda. And that was really my first step into research and learning on a bigger scale. And I really loved it. And I'm just a naturally inquisitive person, and I like to learn about all of these different conditions and patient experiences, mostly because even though so many of us have different conditions, we overlap in so many ways in terms of, I know you talk a lot about mental health and just caregiver mental health, and various
Yep.
aspects of like daily quality of life are so similar regardless of what someone is experiencing that it just makes me want to learn more about each person and each condition.
Yeah, I'm definitely in the same boat. I obviously did not go to medical school, but did spend 10 years working in the industry, and that kind of gives you a base. And then the other thing too is, you have to be good at the research, no matter whether you
Yeah.
have the degree or you don't. To write good content, you have to be a good researcher. And I think from there, if you are not the best writer, you can hone that skill. But if you are
Yeah.
not good at research, that's a skill that's really hard to hone. And that's what I've heard from people that I've, worked with, or, I always ask my business partners, like, what do you like to do? Because if you're not into the research, this is not the job for you.
Right, exactly. You have to love learning. You have to be patient. You have to be willing to kind of learn all of those things in order to develop something that's worth reading.
Yeah, and I think to always remember, to anyone listening that's thinking like, oh, it sounds like a lot of work, the bulk of the work is going to be up front. In
Mm-hmm.
those first few months, that's when you're really learning the intricacies, the deep science. That's when you're kind of going back to your biology book and really trying to understand, how this disease works in the body. And once you get that basis, then going forward, everything else does feel a little bit easier. I mean, definitely not always, but
Yeah.
I think in our world as content creators for the life science and healthcare world, there are very few people that do have the scientific degree and the writing skills. It is just, a left brain, right brain thing. And if you are one of those people, call me because I could use you. If you are one of those people, it's very lucky. But
Yeah.
most people do not have that acute scientific brain and creative writing brain. So I think a lot of people in your role are people like you that have somewhat of a background in, a translatable background or transferable background, or like
Yeah.
me that have spent a long time in the industry and just kind of, know the rules of the road. So I think that ability to be able to do the research, that's another key skill that people like you and I need to have in order to be successful.
Yeah, absolutely.
So how do you incorporate the patient's lived experience? Are you literally writing like, and then Lauren woke up and felt sick that day? Or, tell us, like we are that third grade reading level, how do you literally incorporate a patient's lived experience into those materials?
Yeah, so we have a really great team at Global Genes, but just in general, if you are encouraging people to tell their story, they are doing it kind of out there on social media or submitting to a blog. And it's really easy to pull from all of these different lived experiences. But I think for me specifically in my role, we work with patient advocacy group leaders
Oh,
usually patients themselves are leading these advocacy groups. And so we get to talk to them directly and ask them what is important. And it's really as simple
yeah.
as that. Like what is important to you, and what is like when someone asks me about my story or my conditions, and they say, oh, okay, I kind of know about those. And I'm like, yeah, but right now my biggest symptom is this. And so to
Yeah.
me, learning those kind of just intricate details and really how we can expand researchers and clinicians' horizons essentially to not just these like very defined, okay, you have Ehlers-Danlos syndrome, that means you're hypermobile joint pain, like, and it goes way beyond that. Honestly, it's an everyday thing that people deal with. And so being able to expand what researchers might consider to even look at is the reason we incorporate those lived experiences. And the only way to know those is to do this kind of cross symptom, cross disease research, because I can guarantee there are so many conditions out there, rare and chronic, that
Yeah,
everyone is experiencing pain. So let's get
absolutely.
some more focus on this things so that, you know, we don't have to just say that, oh, it's just because she has EDS.
Yeah, and that's so interesting. That is going to be my next question. Does the patient influence what the research is? Are you going back to the researchers and the clinicians and saying, like, you're telling me all these symptoms, but the patient doesn't care about any of those. Let's work on something else.
I think they definitely can. And it
Yeah.
really depends on how open the researchers are to, you know,
Yeah.
looking at these things. And there's definitely opportunities. So Global Genes and RareX does an open science data challenge. And that's an opportunity for people to get into the data that's been collected across many diseases and see if they can start linking some of these cross symptom issues that people are having. There's there's challenges like that out there. And then there's always, hopefully, industry, this year has really focused on being patient centric. That's kind of the buzzword of the year. And so hopefully different companies, pharmaceutical companies, are truly embodying that by having a patient engagement officer or a patient advocacy officer who is talking to these patients and saying, hey, like, here's our idea. Here's the drug that's focusing on the symptom or the gene or whatever. What do you need for your community to be able to trust us and take that next step?
And trust is a huge thing in especially our culture and just across the globe, because, the healthcare industry is tough when you have a lot of chronic illnesses, when you have a rare disease. Do you ever speak with patients or advocacy groups that are, just feel like you can't meet them where they're at because the healthcare world doesn't understand, or the researchers are, so focused on their science? Does that ever happen?
For sure. It definitely does. I think there's always times where patient advocacy groups are like, we need this thing and we need it immediately. And there's just no research even happening out there, which is so unfortunate. There's 10,000 plus rare diseases. I'm going to speak specifically to rare because that's kind of my space, but there's just not enough researchers out there to be doing research on every single disease. So a lot of times these patient advocacy groups are becoming, researchers themselves. They're signing up to have data collection done, and then they're going after funding, and they really become these great nonprofits and trying to do the research themselves. And then again, something we can do at Global Genes and RareX to even help them is take that research to a researcher through the right communication. And so that's great. That becomes part of what we can do as a marketing team and as a, communications team, is teaching patient groups who maybe don't have a lot of funding or don't even know where to start, but giving them the toolkits to establish the right communication with pharma, with biotech, with whatever they need, so that they can go out and try to get more researchers interested in what's going on with them.
Yeah, because a lot of these advocates, especially in the rare disease world, are parents. They are people that probably do not know anything about the life science world or how research works, but they are literally teaching themselves because, their kid's life is on the line. And what wouldn't you do for your kid? So if it means trying to fund research to save their life, like, of course, any mom or dad would do that. But most of these parents, don't have the luxury of knowing the industry or how it works. So I just think about that.
It's such a hard, unfortunately, the healthcare systems were not built for complex people. They were not built for preventative care and kind of that upstream work that we really need. It's all sort of like, okay, you're sick, now you get medicine. Okay, things, all of these things kind of react to whatever's happening in that moment, versus, okay, let's try to prevent further upstream. And I think that becomes really difficult when you do have these complex things. And even as an individual, learning to document your healthcare and document your history, and then being able to effectively communicate that as a patient to your clinician is also really important.
Yeah, and I think that's something that we don't do, and candidly, not something I always think to do. I always try to, like, if I think of something, try to put it as like a note in my phone. But
Yeah.
it's not our instinct to go to the doctor with a list or anything like that. But I do think that's what we need to do is be ultra prepared. And then that can, if you are ultra prepared and you are part of an advocacy group, you can literally pass that information off to Mackenzie,
Exactly.
and then she can help with, you know, creating the materials to translate that to the doctor, because you may not be able to when you're in that, small room wearing your little Johnny. Like, the last thing you want to do is, whip out the phone or a piece of paper and start listing all the things wrong. I mean, that is in theory what we should be doing, but it's hard. You're scared, you're overwhelmed, and if it's a caregiver, they're probably so focused on how's their kid doing. So I think really on the patient side, it's documenting and really just keeping tabs on all the things that you wish somebody was working on for you, or that you want to
Yes.
express with your clinician. So what about the other side? What can researchers do? What can clinicians do to bridge this gap?
Yeah, I think researchers and clinicians can really first be empathetic listeners. That's all patients want.
Yep.
Be empathetic.
Look them in the eyes. That's all I say.
Yeah, exactly. And kind of, for just a moment, take off their researcher or clinician hat and think, they are human as well. And so how can they effectively communicate with one another? The other thing I think that everyone wants is opportunities and options. And a lot of times as patients and caregivers, we feel like there aren't any. So researchers and clinicians can continue to empower patients to be part of the process, right? So patient-centric means you involve a patient in planning the research, knowing what they want, using that lived experience, writing and developing content for them in ways that they understand. So as a researcher, you definitely want to get your research and science out there. But that is only helpful to other researchers. It's not very helpful to patients, right? So explaining that in a way, explaining it in a way that patients will understand is really important. And so researchers and clinicians can really be a great resource. And so they should also know what other options there are for patients, especially clinicians. If there's research happening, and if they don't know, say they don't know, but then offer to help, offer to look that up, offer to kind of guide the patients in a way that will make sense.
Yeah, because I think a lot of times patients end up feeling like a little gaslit, like they are told you're fine and then kind of move on. But and then they have to go to another doctor who also says they're fine. And then until they go to the 10th doctor who's like, hey, I've actually heard of this disease. And I don't think it's the doctor's intention to do that to patients. I think that they just truly don't know, and they're using the toolbook that they've been given. And especially for a rare disease, they're not going to know 100,000 rare diseases. So it's the system is not designed for people with complex illnesses. The system is designed for people that get the flu every once in a while, basically. Is what it comes down to.
Exactly.
So, and even, but it's definitely, really, I think our healthcare system needs an overhaul. Anybody listening is not going to disagree with that, but what can we do in the meantime? How can we best help patients in our lives? How can we try and connect with the clinicians or researchers in our lives or not in our lives? What's kind of your final piece of advice for people listening?
I think what's really cool is we are moving in a direction of listening and listening to patients more and more frequently and connecting them. The FDA has so many opportunities for patients to talk during various kind of meetings where they need to hear, like, what do patients need? So many different pharma companies are also doing the same. They have entire roles for, like chief patient officer roles that are there specifically to ensure access, affordability, and communication with patients. So I think in the meantime, as we continue to move towards this like patient-centric future, we just need to continue to meet patients where they're at, continue to drive researchers to explore so many different research opportunities. Maybe, when you get into research, you probably have this one thing in mind that you're like, I'm going to go study Alzheimer's, right?
Yep.
But there's a lot of opportunities for people studying Alzheimer's to expand that to other conditions where maybe there are symptoms that are similar to Alzheimer's, but they're just not thinking about it right now. And that's where that lived experience and learning about the conditions and being a researcher is really going to play a part in what we can actually do and kind of this, cross symptom research.
I love that. And actually, final question to the people in your shoes that are kind of in-house or doing this on their own, like, as contractors, I guess, what would your final piece of advice on how to create that content to the most effective degree? If you kind of had to summarize, what you do in your career in like a few sentences, what would that advice be? Because I think, at the core, we're here to talk about how to create the content. And I just want to make sure that people leave and understand, like, all right, I'm doing the right thing, or here's the way I could do it better. So give us your pitch.
Yeah. So I think if you are in my shoes and, either you're a patient or even if you're not, but you are able to kind of have that researcher side and work on patient content, researcher content, all of that. What I've learned a lot this year and in this role from both Lauren and Lily Sayers from Chronic Boss is, being your authentic self is so important. I started really sharing my story this year, which I think has helped me in creating that content and just wanting to even, learn from others even more. So be authentic. Earning the trust of patients is probably the most important thing in this kind of really complex content space. And I think being my authentic self and telling people like, I hear you and I get what you're going through is what has helped the most. So I encourage everyone to just continue to be themselves, share your story. If you're a patient, it will get seen by the important people. And if you're a researcher or a clinician, definitely, listen to the patients when they tell you what they need, because it could be the one little thing that unlocks this key to something we haven't discovered.
Oh my gosh, that was a beautiful way to wrap it up. I love it. Well, thank you so much. This is the end of our transforming complex content into compelling content, or whatever I called it, series. I'm super excited that we wrapped up on this beautiful note. This is personally something that I care very deeply about, and I do for a lot of my clients. And as a patient myself, I know that struggle of trying to articulate, especially as a child. So I think that's, if you're a mom or a caregiver, hearing this conversation hopefully inspire you to just continue advocating for your kid. And but anyways, that wraps it up. And as you guys know, you'll see little snippets of this throughout the rest of the year. It will be on YouTube as well. And actually, I am taking a break in July because I'm going to be out for 2 weeks. And I'm super excited. We will pick back up in August, and it is all about reduce, reuse, and recycling your content, not your trash, but that's always important too. So, and we have a full schedule. If you guys are ever interested in sitting in Mackenzie's hot seat, shoot me a note. We're always looking for great speakers. But have a lovely weekend and a lovely 4th of July for the Americans and a lovely July. And I will see you guys back in August.
Amazing. Thank you so much, Lauren.
And, oh, of course. End stream.